First thing on the agenda is a update from Dr. Polsky.
Morning, gentlemen.
Morning.
Morning. Good morning.
Just a moment. So overall, good news for the moment. As always, it's going to be tinged with a little bit of caution as we move forward. So you can see over the last month, the number of cases have been dramatically lower than what we were seeing, certainly through the winter, but also when we had that bump in cases when the Alpha variant showed up over the springtime. So you can see week by week, we hit an all-time record low the previous week of only 3 cases, nudged back up to 12 cases the week ending the 7th, and we're only talking every 2 weeks or so now. So just as a reminder, we do cases from Thursday to the following Wednesday to avoid statistical lack of reporting over the weekend so we can get consistent numbers. The only thing I'll point out is that the number of tests that are being done have dropped locally, and that also reflects what we're seeing statewide and nationally. Part of that is likely that less people get sick in the summer in general, and we also suspect that less people are kind of coming forward to getting tested. So I don't want the perception that there have only been 12 people with COVID in the county over the past week. Those are the number of people who've been tested and have tested positive. I think what I'm most happy about through all this is, as you take a look toward the right side of that slide, over the past 4 weeks, there has not been a single case of anyone over 75 in Calvert, and this past week, no one over 65. Certainly, we all know that we've seen the highest number of hospitalizations and deaths in that age group. The one group that has jumped up a little bit over this past week is the 28 to 35-year-olds. And I will say that currently the only person who's hospitalized in the county is someone in that age range. So when we take a look statewide, again, this is the previous week. The number of cases were 519, and then number of deaths the previous week, 14. Current hospitalizations, and I have to prepare the slide a little bit ahead of time. So these are numbers as of this past Friday. So up on the slide is 113. Currently, as of this morning, that's risen to 134. And the number of people in the ICU has risen from 34 as of last Friday up to 45. There statewide have been a 55% increase in cases from last week to this week, and the percentage of hospitalizations, ICU admissions, is up about 20 to 33%, depending on which category that you're looking at. And that is certainly reflective of the Delta variant that I'm sure you've heard about on the news, gaining traction in Maryland. Across the country, actually I'll get to Delta in just a moment. So I do want to touch on June statistics for one very important reason. So statewide, there were a little over 100 deaths due to COVID across the state. 2 of those deaths were Calvert residents. And the next line is what's most important, that all the deaths in Maryland during June occurred in unvaccinated individuals. And so I would say that we had 102 preventable deaths in the month of June. And that it's not just that there are 3.2 million vaccinated Marylanders, none of whom died from COVID during June, but when you think about it, the vaccination rates in seniors is close to 90%. So if those people were all unvaccinated, then we would have close to 10 times the number of deaths just from that age group. Plus, you have to factor in the number of circulating cases would be much greater, so the probability of people getting infected would be higher. And so vaccines are dramatically decreasing the number of deaths that we're seeing both locally, across the state, and certainly across the country. So just touching on the Delta variant, I kind of jumped ahead of myself a little bit. So it's actually not the predominant strain at this point. It's 40%, as of today, 40% of the cases in Maryland are from the Delta variant, 50% from the Alpha or the UK variant, and then the other 10% are a variety of the either original strain or the other variants that have popped up. The importance for the Delta variant is that studies, and these are mostly out of the UK, where the Delta variant showed up about a month before it became more prevalent in the United States, that the Delta variant is at least twice as contagious as the original strain of COVID, and it multiplies at a much faster rate. So what they're seeing in studies is that when they do cultures and then look for the number of virus particles, that the average person with Delta variant has about 1,000 times more virus particles in their respiratory tract as people with the Alpha variant and with the original strain. And they're becoming symptomatic on average about 4 days after infection as opposed to about 6 days. So the transmission rate, instead of taking 6 days to go from generation to generation, it's 4 days. So you're seeing a much faster propagation with this virus strain. They're also seeing the highest infection rates in children. So children between 5 and 19. And so we're looking at sort of a different playing field with the Delta variant than we were with certainly the original strain and even with the Alpha variant that we were dealing with last spring. Studies have also shown that with the Pfizer and Moderna vaccine that a single dose of vaccine is only about 1/3 protective against the infection. But if people complete the 2-dose series, it's about 90% protective. And when you look at hospitalizations and deaths, then you're looking at somewhere between 95 and 97% protection with 2 doses. I don't have data up there for the Johnson & Johnson because I haven't seen any studies. The AstraZeneca vaccine, which is not available in the US, but is the closest to the Johnson & Johnson, and that is the most commonly given in Europe, shows about 60% protection against the Delta variant. And I'm going to point out that over 1,000 Calvert residents have only received 1 dose of their vaccine who are now eligible. They're now more than 28 days since they got their first dose. So it's really important for all those people to go back for their second dose. Even if it's been 3 or 4 months ago, they only need a single dose. They don't need to start the series all over again. The health department is trying our best to individually call everyone who has not gotten their second dose so we can make sure they go from 33% protection up to 90% protection. And then just to finish up, statewide, we're still doing great with our seniors. We're still second highest percentage in the state as far as people 65 and over. Among teens, we're 7th among the 24 jurisdictions. Now, I will point out that at this point, only 45% of those 12 through 17 have been vaccinated in the county. So 7th is good in rankings, but that still means obviously 55% of adolescents are still completely susceptible to the virus. And then when you look at all eligible residents, we rank 11th, which is where we've been for a few months now. So if you subtract out the 65-year-olds who are doing really, really well, and you just look at the 18 to 64-year-olds statewide, 29% of all Marylanders in that age range are unvaccinated, but in Calvert is 40%. So our 18 to 64-year-olds are lagging significantly behind others in the state, and that means we have over 23,000 adults who are completely unvaccinated, and then if you include in everyone under 12 is unvaccinated, plus the remaining adolescents, we're looking at 42,000 people in this county who are still susceptible. I know that some of them have had COVID and they are less likely to get infected, but with the Delta variant, we're seeing less natural protection from a previous infection. And so those people don't have the same level of protection they would have if we were back several months ago. I'm anticipating, given what we're seeing right now, unless our vaccination rates pick up substantially over the next couple of months, that as we head into fall, and almost certainly we're going to see a rise in transmission of the virus, we're probably going to have somewhere around 30 to 35,000 people susceptible, and we will see outbreaks, and that will also have consequences in our schools. So I'm not going to go through the charts. I just have them up in case anybody at home wants to actually look at the raw numbers. So it's broken down by 12 to 17-year-olds, all adults, and then 65 and over. And then I will just remind everyone that for anyone who needs a second dose or for anyone who has not yet gotten vaccinated, that you can log on to our website and directly schedule an appointment. We are still running, I think, 4 days a week right now at our MassVac site, and most, if not all, the primary care practices in the county are offering vaccines, including the pediatric practices. So I would encourage people to call their personal doctor or nurse practitioner to schedule an appointment. And certainly, as I will continue to reiterate, if people have concerns, have questions, because all sorts of rumors fly on social media, don't take your health advice from a website. take your health advice from your doctor, take your health advice from your nurse practitioner, and happy to answer any questions at this point.
So Dr. Polsky, there's been some on the news the past couple months about different side effects.
Right.
So are the side effects related to these vaccines any different than side effects to any vaccine that's been administered over time?
For the most part, no. So yesterday, people at the FDA, they are great scientists. They are horrible communicators. The big, it's going to lead on the news, a warning about Guillain-Barré syndrome. That's a known potential for multiple vaccines. The numbers are, for flu vaccine, is about 1 in a million, maybe 2 in a million. But the biggest cause of Guillain-Barré syndrome is virus infections. Well, and I also say Campylobacter infections, which is a foodborne food poisoning like salmonella. But the flu itself, when people get the flu, they're a much, much higher risk of getting Guillain-Barré syndrome than they are from getting it from the vaccine. I could not find good numbers for COVID, and that's because this is still kind of things aren't regimented as far as reporting. For vaccines, they are. But I did see a report from back in March, specifically about Guillain-Barré syndrome for people who have had COVID infections. And in the case series, which was looking at 50 people who had Guillain-Barré, they were predominantly male, and almost all of them were 50 to 76 years old. What the FDA came out with its statement yesterday was predominantly male and predominantly over the age of 50. So the people who are at most risk of getting Guillain-Barré syndrome from COVID are the ones who have some potential there. I will say, by far, the risks of getting COVID infection way, way outweigh any risks from the vaccine itself. And I would look at it, this is maybe not the best example in the world, but ambulances, there's a risk that ambulance could get into a crash on the way to the hospital. But your benefit from getting in that ambulance, if you're at serious risk from complications, way outweighs. Ambulances save at minimum hundreds of lives every day in this country. I don't see them slapping warnings on the ambulance, warning this ambulance may get into into a crash. That there's a clearly defined risk with COVID. It way exceeds what we've seen from these side effects. And certainly to your point, Commissioner Hance, there is nothing that is completely side effect free. Every antibiotic we take, every diabetes medication, there's always potential for liver issues or kidney issues. But again, the statistics speak for themselves. We are, across the country, we're saving thousands of lives every week because of these vaccines. We're not seeing thousands of people die from any of the side effects that have been reported.
But sometimes if you watch on the television, the commercials for medicines, not even vaccines, just medicines, a 30-second commercial. One day I timed one. It was 25 seconds of warnings of side effects. So, there's always going to be, those cases. But as you say, we need to remember that, and weigh the risk and the benefits. And,
Absolutely.
So,
and again, that discussion for you specifically, the risk benefits for a 16-year-old are different than the risk benefits for a 60-year-old. And we've seen slightly different side effect profiles with different vaccines. So, if I had a patient who was a 30-year-old female, I would not recommend the Johnson & Johnson, even though those blood clot risks in young women were very, very unusual. We didn't see them at all in young women with Moderna or Pfizer. So you can't have that personal discussion on a website. I can't have that personal discussion as I talk here, but everyone has the opportunity to have that discussion of what is best for them with their personal providers.
any other questions?
Just briefly, Dr. Polsky, the mass vac site on Skipjack, what is the plan for dismantling, a time frame?
At the moment, we plan on keeping it open until Labor Day. My most important concern at this point is that for students returning to college campuses who need vaccination, we know that some of them do not have a personal physician. I want to make sure that they have an avenue that they can get their vaccines. After that point, I think part of it depends is the FDA going to approve the vaccine for children at that point? What is the real need for the drive-through? We may end up phasing it out after Labor Day. And again, we've all seen how unpredictably COVID has evolved in all sorts of ways. So at the moment, I'm not ready to say we will close after Labor Day, but there is that possibility.
Thank you.
Anything? Nope. Thank you, Dr. Polsky.
Thank you all.
Thank you.